November is Pancreatic Cancer Awareness Month, and joining us to tell us all about what the Pancreatic Cancer Action Network is doing in a campaign that they are launching all about awareness and more is Julie Fleshman, CEO of PanCAN. Thank you so much, Julie, for being here. How are you today?
I'm great. Thanks so much for having me.
So tell me about this campaign that you are launching specifically this month.
So PanCAN believes that knowledge is power, and this month we want patients, family members, healthcare professionals, and the public to be talking about testing for pancreatic cancer. Talk, test, take control.
How important is early detection within pancreatic cancer?
So one of the things that makes pancreatic cancer such a difficult disease is that there is no early detection test for pancreatic cancer. The symptoms are fairly vague and benign, so usually by the time someone is diagnosed, it's late stage and it's difficult to treat at that point. So we're making steps, incremental steps towards an early detection test. And so what we're talking about today is testing, both biomarker testing and genetic testing for patients, and that information helps to determine what treatment option may be best for a patient. And we're also talking about testing for first-degree relatives of a pancreatic cancer patient to better understand their risk of developing pancreatic cancer. So while it's not an early detection test, if someone better understands their risk, they're more likely to be paying attention to their body, to understand the symptoms, and potentially be diagnosed earlier than they would be otherwise.
Which individuals should be most concerned about getting these tests done? And how do you know if there aren't a lot of symptoms? How do you know if you're one of those people that really needs to look into some of these options?
So PanCAN recommends that first-degree relatives of a pancreatic cancer patient, so a mom, a dad, a sister, a brother, or a child, consider genetic testing. And we recommend that those individuals talk to a genetic counselor who will help them better understand their family history of cancer and whether they should be concerned and get genetic testing to better understand their pancreatic cancer risk. And PanCAN's patient services can help someone prepare for that conversation with a genetic counselor.
Unfortunately, there's been some individuals in the public eye recently who have passed away from pancreatic cancer. Their tragedies have really put a light on this type of disease. How has that helped spread awareness?
Yeah, I mean, unfortunately, when public figures are diagnosed and then are willing to talk about the disease, Alex Trebek is a great example. You know, he was diagnosed with pancreatic cancer. He openly talked about his diagnosis and what he was going through. And that just raised such an incredible amount of visibility of people understanding the symptoms of the disease, understanding why PanCAN needs help, why we need support, why we need people to volunteer and to donate. So we're very lucky to have someone like Alex Trebek as a spokesperson and an ambassador who really did help raise the awareness. And most importantly, for patients who are going through the disease, to see someone like an Alex Trebek talking about it really helped patients then say, okay, he's going through this, I'm going through this, we can fight it together.
And PanCAN is launching this big campaign this month. I know you're doing interviews such as this, but how else are you working to get the word out?
So yes, we're doing interviews. We have a wonderful webinar that we will be hosting on November 18th on World Pancreatic Cancer Day that I would encourage people to go to pancan.org and register, where they can learn more about this important topic that we're talking about. People can also go to pancan.org to learn more about pancreatic cancer, to learn more about testing, and to find out how they can get involved with our efforts.
And Julie, what has made you so passionate about being involved in this effort?
So unfortunately, my father was diagnosed with pancreatic cancer back in 1999. He was 52 years old and he only lived for 4 months after his diagnosis. And I was angry. I couldn't understand at that time why nothing was being done. And so I joined PanCAN as their first employee over 21 years ago. And I've just had this honor and privilege of leading this amazing community of healthcare professionals, of patients and families who all want to change outcomes for patients, but we definitely need the public to step up and get involved, to donate, and to help us spread the word during November Pancreatic Cancer Awareness Month.
Julie, I'm so sorry to hear of your tragedy, but I know you're doing an incredible job leading PanCAN and helping spread awareness. Once again, where can we get more information?
Please go to pancan.org to get more information about what we've talked about today. Our patient services are available free of charge to anyone in the public who has questions and wants to be connected to one of our trained case managers.
Thank you so much, Julie Fleshman, for being here today. Appreciate you talking with us more about this campaign, helping spread awareness during this Pancreatic Cancer Awareness Month. We appreciate your time with us today. We'll be back with more right here on Mountain Connections right after this.